Hi, I'm Monica Paslaru of Elemental Massage Therapy and tutor at Gateway Workshops. And for those of you that don't know me, I provide a range of well-being services from massage to craniosacral therapy, energy healing, and cognitive behavior therapy. And I specialize in anxiety and panic disorders for children and adults. It's Mental Health Awareness Week, and today I thought I'd come and talk a little bit about how to recognize and prevent fear and anxiety in children, because I expect more and more children will unfortunately show signs and symptoms of anxiety due to the current circumstances that are happening out there in the world. So what I'm going to talk about today is how to distinguish between the normal and the problematic anxiety. What are some of the signs that your child might have an anxiety problem? And I will also give you some effective strategies to help your child to manage their fears and anxieties. Now, for children that are living with emotional instability and sometimes inconsistent parenting, the unfortunate circumstances such as not being able to go to school, not being able to see their friends, the lack of freedom, this will have a huge impact on their ability to feel safe, and it will result in them experiencing high levels of anxiety and stress on a daily basis. So I really hope that this video will encourage parents to reflect on their children's behavior and communications in order to improve understanding and promote a greater awareness of the impact that the external circumstances have on their mental health and just general well-being. I also hope that this video will give you a bit more knowledge and perhaps change the way that you respond to your children's behavior, because that will make them feel a little bit more accepted and understood, but it will also positively influence your relationship with them. So first, let's explore what anxiety is and how do you know if your child has a problem. So anxiety is an expectation that something bad will be happening. Really worrying about things that might happen in the future rather than the present. And I mean, everybody has fears and worries, anxieties, and these in moderation, they're quite normal, okay? In fact, anxiety and fears are really important aspects of our system, and they're kind of like a burglar alarm. So they let us know when something perhaps dangerous or harmful is approaching, and to avoid it. However, anxiety becomes a problem when the frequency and also the intensity of these worries, when they become too much. And young children are more likely to express their fears and anxieties by, clinging more onto their parents, by crying, by tantruming, but also by developing a lot of physical symptoms such as stomach aches, headaches, dizziness. And let me give you some example of what those worries might be. So they might be asking, am I going to get sick? Are kids going to tease me at school? Am I going to wake up in the morning? Is someone going to break into our house at night? Is someone going to kidnap me? Is something going to happen to mom and dad? And one of the most common asked questions as well is, am I going to die? As they get older, these fears and anxieties will change and they become more cognitive and more specific, and they might develop social anxiety or social phobias or more specific phobias such as spider or snakes. Um, so, I mean, like I said, some anxiety is normal, okay? And the short-term episode of anxiety, they're quite normal and they should cause little interference in your child's functioning. So, for example, if your child is transferring to a new school, they may be a little bit nervous, okay, about going to that school, or they may be a little bit nervous about going to a birthday party, or maybe their first piano lesson because they don't know the teacher, and that's pretty, pretty normal, pretty common. And once the child gets to school, they find the children to be friendly, sociable, so their fear goes away pretty quick. Okay, same with the piano lesson. Once they get more comfortable with their teacher and know what's expected of them, then they will be just fine. So as you can see, these short-term episodes of anxiety, they are quite predictable and they're pretty normal. Okay, usually not something that you should worry about. So when do we need to start worrying then about your child anxiety? So there are a few things that you can look out for, and I've mentioned them already. So the first thing is the intensity of the fear. Okay, so is your child's fear response or anxiety response within reasonable limits? For example, being nervous on their first day at school. Or is it really out of proportion to the actual threat, like throwing a full-blown tantrum, screaming and yelling because they don't want to go to school? That's a little bit of a greater intensity. So these are the things that you want to look out for, these intense fears. Another thing to look out for is the frequency of those fears. That's another important thing. So again, if we consider that first day at school, or perhaps even the first week, it's quite normal to express some nervousness about going to school. But if this goes on for longer than that, maybe a month or even longer, then again, that may indicate some kind of a problem. Another thing to look out for is triggers. Does this fear or anxiety occur spontaneously? So when you think about that normal fear, that normal anxiety, typically it's triggered by something that we can understand. As I said, first day at school, perhaps seeing a scary dog, if there is such a thing, trying something new for the first time, okay? But when the children experience fear or sometimes even panic attacks for no apparent reason, and just like that out of the blue, this might be something that could indicate that there is a problem. And one of the most common types of anxiety that I see in clinic is separation anxiety, which is a disorder where the child is afraid to be apart from the parent, or sometimes other major attachments such as maybe a grandparent or somebody that's really involved in taking care of the child. And the reason they are scared is because they're afraid that if they're separated from that parent or grandparent, then something really bad is going to happen to them or to the parents, and then they will never get to see each other again. And usually these children are afraid to be left alone at home. They are usually more clingy, prone to nightmares. They will refuse to sleep alone at night. They always want to get the parent to sleep with them, or they get in bed with the parent. And they will also develop some OCD, like daily repetitive rituals. They also seek a lot of reassurance, which sadly doesn't work. As the children continue to worry, with as much reassurance as you give them. As parents, we want to comfort our children and make them feel safe, but in fact, reassurance can actually lead to worsening of the anxiety. They also complain about physical symptoms, like I've mentioned before, and the most common ones are stomach aches, headaches, dizziness, lack of concentration, fatigue, general muscle tension, sweating, increased heart rate, shaking. And they often use these excuses to stay at home and to be with a parent. And And we tend to see this separation anxiety flaring up in children of ages between 5 and 8. But it can also happen to all the children between the ages of 9 and 12, especially if they have suffered a loss. So when this anxiety becomes a problem, when the anxiety leads to significant avoidance, so the child refuses to go to school, or they refuse to go to that piano lesson, or to that birthday party, the child may even refuse to be around people that they're familiar with, such as their own family, friends. Then in that case, when we see that the anxiety results in the child starting to avoid those important things or things that they should be doing, then that's when we think that it might be time to perhaps talk to somebody about getting some help. But there are some things that you can do at home to perhaps manage the child's anxiety better or even prevent it. So this is what I'm going to talk about now. I'm going to tell you what are some of the things that you can do to manage your child's anxiety. So first of all, you need to understand a little bit more about how anxiety works. And there is 3 important parts of anxiety. The first one is the thoughts. Okay, people with anxiety have loads and loads of worries, loads of negative thoughts. They tend to see the world as a very dangerous place. Even the most positive things, they tend to see them as potential danger. For example, like going to that birthday party. For most kids that would be fun, but for an anxious kid, it's not going to be fun. They might worry about getting lost, or might worry about not having any friends to play, or children making fun of them. So it's not going to be fun for them. The anxious thoughts, they're coming, messages, sometimes images that run through the head when we're anxious. It's that inner monologue, okay? It's always running, always saying something. They never shut up. And sometimes it's not, always about anxiety, but they are like automatic thoughts, they just pop up in your head, and you sadly don't have to do anything about making them happen. They just happen, okay? And because this is an automatic passive process on your part, it's not something that you sadly have control over. No one can control what thoughts pop up into their minds. So for example, if I tell you now, don't think about a pink elephant, what are you going to think about? A pink elephant, of course. You can't help it, no one can, okay? So although we can't control our thoughts and we can't stop them from coming into our minds, we can change the way we think, okay? And I'll cover this shortly, because this is part of the process that I do in clinic. Another part of anxiety is feelings and emotions, such as the physical symptoms. And here I mean the emotion of anxiety itself, the feelings that we have when we're anxious. The specific physical feelings of anxiety will vary from child to child, but I have mentioned a few of them already anyway. Tightness or pain in the chest, lightheaded, feeling stomach ache, headaches, the muscle tension, shortness of breath, and sometimes children complain that they feel a lump in their throat. They will experience these feelings as uncomfortable or sometimes even painful. And of course, understandably, they want to get them to go away. But unfortunately, like the anxious thoughts, the feeling of anxiety doesn't respond to our efforts to control it. So the more you try to make their anxiety go down with reassurance, the worse it gets for them. And then the last part of anxiety is our behavior. Your children's actions and what they do. And that normally translates through avoidance, clinging, crying. These are some of the behaviors. Now, unlike thoughts and feelings, behavior is the one that we can actually have control over. Okay, for instance, in that birthday party example, even if they're anxious about going to the party, they do control whether they want to go or they don't want to go. You know, they can choose to go or not to go. So as a parent, you want to pay attention to the thoughts associated with anxiety, the feelings, the emotions, as well as the behaviors, because they will all interact with each other. And it's like a vicious circle. It goes around and around and around, and you know, the more scared they start to get into their thoughts, the more their body is going to react and show those physical symptoms, which is then going to lead to those anxious behaviors. And then again goes around where it started to the anxious thoughts. So as you can see, this just goes around and around, and unless you do something about it, then it kind of never ends. It's like a vicious circle. Now in treatment, what I do is I break the connection between the thoughts, the feelings, and the behaviors. And the way I do that is by using a combination of cognitive behavior therapy and craniosacral therapy. So what I do in cognitive behavior therapy, I will work with the child on changing those thoughts and the feelings first, and then that in turn will lead to more positive behavior. And in craniosacral therapy, what I do is I work with their body in a very gentle way and put them into a parasympathetic state, which will enable them to relax, become more aware of their breath and also of their feelings, and that in turn will just start the healing process for them. Okay, so let's have a look at an example. So let's say your child wakes up, it's time to go to school, the separation worries will start, and then they start to complain of those physical symptoms such as, you know, have a stomach ache. The tantrums will follow, and then finally the parents will give in, and the child gets to stay at home. And what happens when they stay at home? You probably guessed it, the anxiety goes away because the perceived threat is gone. However, what this does, unfortunately, is going to serve as a negative reinforcement, which means that if I do something and it makes the bad thing go away, then I'm just going to do that more and more. Okay, so there's a few things that you can do at home to break this cycle as well. But just know that the more you give into your child, the worse their anxiety gets. And the more you give into those tantrums, the more you teach them to use tantrums to, you know, avoid whatever the situation is, like staying at home or going to school. So you have to avoid giving into your child's fears, okay? Don't give in into their attempts to avoid things that they should be doing, like going to school. And I understand that this is something really hard to do on your own, especially if the child has significant tantrums, okay? But parenting is often more important than the work I do with the children in clinic. So one thing that you can do when you get into these situations, you know, the most important thing actually you want to do is to disengage from the tantrum at the earliest point. Okay, the worst thing that you can do is get into a screaming match with your child, okay, because that's just going to make you both upset. What you want to do is disengage at the earliest opportunity, and you want to be quite firm with them. Okay, you're going to school, here's your breakfast, I'll be back in 5 minutes, or whatever your ritual is, but just be quite firm and leave. It's important that you remain calm, because if you're getting upset, then the child will get even more upset. If you can keep you calm, then the child will eventually give up. And what I'm gonna say is, please don't use punishment, okay? Because that will just escalate it even further, and the child will get even more upset. There are a few other things that you can do to try to break these cycles. you can, well, first and foremost, you have to control your anxiety, okay? That's the most important thing that a parent can do. Because as a parent, and I myself am a parent as well, when our children get upset, we worry, okay? And I know that because I worry about my children. But the children see that anxiety, and that makes them even more worried, because now they think that there is actually something real going on, so they worry even more. That doesn't mean that you can't worry about your child, okay? It just means that you have to take your worries somewhere else, somewhere where your children can't see you. So if you're seeing days and days when your child is exhibiting these symptoms, that may be a little bit concerning, and you may want to seek additional help, okay? Now, that's it from me. I hope you found this helpful, and thank you so much for watching. For more information, you can visit my website, or if you have any questions, you can send me an email. Okay, until next time, have a great day.